the difference between physical therapy as a discipline and physical therapist as a provider, and how people get referred to physical therapy as a discipline.
Yeah.
It is a complete fallacy versus people getting referred to a physical therapist to receive services related to their musculoskeletal needs. We are the only discipline that gets referred to as the global discipline label, which, like, how many times do you see someone being referred, go get some cardiology? And like, I think something's wrong with you, go get some cardiology. Or, right, like you just don't. We're the only discipline that has a prescription that says, go get some physical therapy, and then we fill it. And then so few of us have enough autonomy and agency to question or to actually communicate, because you are a professional. So you are a doctor of your profession, or you are a physical therapist who is a tenured clinician with a lot of experience. Your job, responsibility, your professional responsibility is to advocate for the patient and to actually provide the best available care in the time. And if there is some kind of a conflict, your responsibility is to be part of that larger healthcare system. Communicate, right? Like, pick up the phone and communicate. Address that other professional. A lot of times, and I'll actually ask you to discuss that one of our listeners, Cody, right? Who's actually a testament to agency in a qualified form as a professional who is acting on his professional responsibilities. But as a clinician, it is your responsibility to engage with other healthcare providers, because it's part of the same parallel. We shouldn't treat healthcare professionals as a hierarchical system where we are physician extenders, we're physical therapists, then there's the next step, then there's the next step, and then there's a physician. That is wonderful, but that paternalistic model, it is one of the reasons why the healthcare consumption is so high, because there is that like a worship of a pinnacle of description, and we are just fulfilled. We fill scripts. We are physical therapists that are disciplined, right?
We can't get out of the fee-for-service cycle and be treated differently and be valued by other providers in caring for patients in a way that they can trust is going to be the best thing, and right, and develop that relationship if we're just going to fill prescriptions. Now, I want to believe that it's changed to some degree, but frankly, that's why one of the many reasons why I couldn't function in the fee-for-service system in an outpatient setting is that wasn't supported by my employer. I mean, it's crazy. We say, why don't doctors think of us as equals? And why don't patients think of us as equals? It's comical, honestly. And it's still happening. So we can't have what we want as a profession if we keep feeding the fee-for-service cycle. We have to find a different way. And there will be prediction. There will be practices that do a much better job, and providers, maybe individual providers, that do a better job at developing a collaborative relationship